Hello, my name is Dr. Pini Tsukerman, and I'm the co-founder and chief scientific officer of Nectin Therapeutics. I want to thank the organizers for having us here today. I will tell you about NTX1088, our first-in-class blocking antibody targeting PVR, which can restore expression and function of DNAM1 for optimal anti-tumor immunity. PVR, or CD155, is an immune checkpoint expressed by tumor and antigen-presenting cells, and it is a rate-limiting factor for the activity of approved immune checkpoints such as PD-1 and CTLA-4. PVR exerts its immunosuppressive activity by multiple pathways, including skewing of the antigen-presenting cells to secrete immunosuppressive cytokines and directly inhibiting T and NK cells by interacting with TIGIT and CD96, the inhibitory receptors, and with DNAM1, the activating receptor. The interaction with DNAM1 is not leading to sustained activation. Rather, DNAM1 is rapidly internalized and degraded. This was independently confirmed by the immunity publication shown here from the two groups of Mark J. Smith and Tobias. As I mentioned, PVR exerts some of its inhibitory activity by interacting with TIGIT and CD96, targets actively explored in preclinical and clinical settings. However, individually blocking of TIGIT and CD96 is not able to completely reverse the inhibitory activity of PVR. Only the blockade of PVR by NTX1088 prevents inhibitory signaling from both TIGIT and CD96 and restores DNAM1 to the surface of immune cells, leading to optimal anti-tumor activity, as I will show you in the next slides. What you can see here is the activity of NTX1088, which is superior to that of PD-1 blockade and synergistic to PD-1 blockade in activation of CD8 T cells. When comparing NTX1088 to tiragolumab, you can clearly see that only NTX1088 can restore expression of DNAM1, leading to superior activity as measured by interferon gamma secretion. Blockade of DNAM1 with NTX1088 restores the activity to levels comparable to that of blocking TIGIT by tiragolumab. To further explore the difference between TIGIT and PVR blockade, we expanded our data with multiple assays using NK cells and dose range of concentrations. What is clearly seen here, the PVR blockade is superior in restoring activation of NK cells as measured by interferon gamma secretion, tumor cell killing, and the induction of 4-1BB CD137 across a range of concentrations. Importantly, at all doses, higher levels of DNAM1 are clearly seen when PVR is blocked by NTX1088. In vivo settings, in models which respond to PD-1 blockade, NTX1088 exhibited similar activity in humanized mice models. Importantly, models that were refractory to PD-1 blockade still responded well to blockade of PVR by NTX1088, leading to significant tumor growth inhibition, and at the end of the study, TILs from these models had significantly higher levels of DNAM1 on the surface of the cell. These cells, when activated ex vivo, showed higher level of interferon gamma and CD107 suggesting superior activatory state due to NTX1088 treatment. In cynomolgus monkey, safety was assessed across range of doses, including 200 mg/kg for 4 weeks. All doses went well and with no adverse events. Importantly, DNAM1 elevation was also seen in dose-dependent manner as a robust PD marker for PVR blockade. As I mentioned, blockade of PVR prevents inhibitory signaling from TIGIT and CD96 while restoring DNAM1, opening a window for a number of combinations. The most straightforward combination is with CD112 blocking antibody, since CD112 competes with DNAM1 for the binding of Nectin-2. In the combination setting, when we restore DNAM1 levels and block CD112, we saw significant elevation of activity. Here is a taste of the data. You can clearly see standalone activity for both blocking antibodies, which is increased over 100% in combination setting. I showed you today data about the activity of NTX1088 in vitro and in vivo immunized mice models. I've also shown some data regarding activity in non-human primates. The molecule is safe and potent. We are planning to submit IND early Q1 2022. Thank you for your time.